Hi everybody, it's Nurse Cathy. It's 5 on Friday time. Well, today we're going to talk about our dental hygiene and our oral health. Now, our oral health gives us clues about our overall health. The connection between the two starts in our mouth. Mouth is full of bacteria, and the mouth is an entry point for bacteria to enter into the digestive and respiratory tracts. Okay, now let's talk about some conditions that have a link to your oral health. Have you ever wondered why, when you go to see your dentist, if you have a history, any kind of cardiac history like mitral valve prolapse, or you've had, say, a valve replacement or something, that your dentist will want you to be on antibiotics prior to even having, say, a teeth cleaning done? Well, the reason being is they want to prevent endocarditis. Endocarditis is an infection of the inner lining of the heart. And what happens, bacteria through the mouth enters into the bloodstream and it attacks the heart. Another condition that's linked to your oral health is cardiovascular disease. Now, researchers don't really fully understand the correlation between the two, but they all do know that those that have had a history of stroke or coronary artery disease do have some correlation with their oral health. Next is pregnancy and birth complications. Now, gum disease is linked to premature birth and low gestational weight. And I want to mention pneumonia. Now, bacteria from the mouth can get pulled into the lungs and create a pneumonia. Okay, here's a statistic for you. 27% of all adults in U.S. have tooth decay. And 70% of adults 65 or older in the United States have periodontal or gum disease. Now, as we age, we have a decline in our abilities to effectively perform self-care. This could be related to arthritis, it could be related to a decline in our cognitive capacities, or other conditions of aging. But we tend not to be able to care for our teeth as we would in our younger days. Now, tooth decay and gum disease are not the same thing, but they do go hand in hand when we talk about our oral health. Tooth decay is basically cavities. Gum disease or periodontal disease occurs when the plaque builds up along the gum line. Thus the reason for those routine cleanings that we need to have done at the dentist office. Now, people with gum disease experience persistent bad breath. They have tender swelling sometimes of the gums, and the gums will often bleed when they brush their teeth. Also have loose teeth, you'll have receding gums, and you can have some pain with chewing. Now, how does gum disease correlate with other medical conditions? Let's say, for instance, diabetes. Now, diabetic is less likely to resist infection. So as we talked about, the mouth is full of bacteria. Let's say through brushing our teeth and things, there's bacteria that spreads into the bloodstream, it goes to the stomach, and you're diabetic. You're going to be less likely to be able to control your blood sugars. Now, someone who has HIV or AIDS, you experience painful sores in your mouth. Now, we know that open lesions and bacteria in the mouth are not a good combination. Okay, osteoporosis. Now, with osteoporosis, it's a degenerative type condition. We have bone weakening, and it can lead to periodontal bone loss and tooth loss. Now, Alzheimer's disease. Alzheimer's is a progressive disease, and as Alzheimer's progresses, then the oral health of the individual goes down, and that's direct relation to the loss of physical and cognitive functions. And tobacco use. Besides staining the teeth, there is a potential also for gum disease, of course, bad breath, things like that. But what about oral cancer? Tobacco use does set you up for oral cancer, and those who use tobacco, alcohol, or have poor oral hygiene, or even HPV are at higher risk for oral cancer. Now, some symptoms of oral cancer are red and white patches on the mouth or lips, bleeding in the mouth, numbness in the mouth, and you also have swelling in the jaws. If you have any of these signs, you need to consult your doctor as soon as possible. Now, something else we haven't thought about is medications. How do medications affect your oral health? Well, certain medications such as decongestants, antihistamines, painkillers, diuretics, and antidepressants can all cause dry mouth. And dry mouth is directly related to a decrease in our saliva production. Now, the saliva has an acid in it which helps fight bacteria and cavities. If you're experiencing this, discuss it with your doctor and or dentist, and they can possibly write you a prescription for a prescription toothpaste or a fluoride mouthwash that will help prevent cavities. So what's the protocol for a healthy mouth? Well, first off, it's regular dental visits, and that's at least twice a year, and that should include a dental exam and also a dental cleaning. Now, if you have more severe issues with your teeth, you're probably gonna have to see the dentist a little bit more frequently. Now, brush your teeth also at least 2 times a day, and each time you brush for 2 minutes. Gentle brushing should be back and forth and with short strokes, and you should brush the inner and outer aspects of your teeth and also your tongue. Now you should replace your toothbrush about every 3 to 4 months. Now we did mention about how age can affect a person's ability for self-care. So if an elderly person is having problems brushing their teeth, say they have arthritis or some kind of degenerative condition that's causing them not to be able to have good oral health, buy them an electric toothbrush, help them out. And then also if you're a denture wearer, brush and soak your dentures. Also floss daily. Now we talked about how with aging sometimes the oral health is affected. So with the elderly, flossing is a little bit more difficult because as they age and they lose that calcium and they have the weakening of the bone structures and things like that, their teeth start to separate a little bit. So it's a little bit harder for an elderly person to floss. And the next thing is use a mouthwash to rinse away any of the food particles that are left behind after brushing and flossing. And then limit your sugary and alcoholic beverages. And also manage your chronic conditions. Now there are also some foods which are recommended for oral health. Number 1, drink plenty of water. Eat whole grains, fruits and vegetables, lean proteins, low-fat and non-fat dairy products, and limit your snacks, especially those sugary snacks. February is National Children's Dental Health Month. Children should begin seeing their pediatric dentist at least by 1 year old, and they should be seen every 6 months, just as an adult would go to the dentist. Now, it's never too early to start your children on learning a healthy habit, so make sure that you have available to those little toddlers as their teeth start coming in, age-appropriate toothbrushes and toothpaste. Well, that's all for me today. I want to remind everybody that Monday, Ashley will be talking about eating for brain health. So I hope you have a great weekend. Bye.